There's been a lot of talk about lowering prescription drug prices, but many say they haven't seen a change at the checkout. In Maryland, real controls are in the works, but if you're struggling now, there are tools that could help. After being diagnosed with adult ADHD, Erica Miller hoped the right medication would finally bring relief.
It's like a forever spinning wheel.
She struggled to organize her thoughts and turn off her creative thinking. Then one day, silence.
Maybe about 6, 7 years ago, when I had gotten my prescription right. And that was the first time that I felt my brain was quiet. It was settled.
But that was short-lived when the cost of her medication kept fluctuating.
1 month it was $400. Then 1 month it was like $70, $80.
She went through a divorce, lost her insurance, and when she couldn't afford her medication, she says she lost her job.
I couldn't follow through on my executive functioning.
Erica is now back on track with a new job, an insurance plan that has significantly brought down costs, but this experience drew her to activism and a seat on the council for the Maryland Prescription Drug Affordability Board.
In 2019, we advocated for the first in the nation Prescription Drug Affordability Board, which simply says you could charge whatever you want, but for this particular drug or these drugs, we're only going to pay this reasonable amount.
Vincent DeMarco, president of Maryland Healthcare for All, advocated for a state mechanism to bring down drug costs.
Drugs don't work if people can't afford them.
It's one of only 4 state boards in the country with rate-setting authority and works similar to what the federal government is doing in negotiating drug prices for Medicare.
We have the authority to do something called setting upper payment limits, which is a novel policy basically to make drugs more affordable for the state.
Andrew York is the executive director for the board. He said they start by identifying high-cost drugs.
Then we do something called a cost review study where we get to really look under the hood and understand if and how that drug is unaffordable for patients in the healthcare system. And then based on our findings, we then recommend policies to make those drugs affordable.
So far, they've looked at 6, mostly diabetes drugs, Ozempic, and autoimmune drugs. He anticipates upper limits could be approved this year, but it only applies to state-sponsored health plans. For now, he encourages all consumers to
talk to your pharmacist and talk to your provider. As you see these bills, you can always ask them, and they're kind of your frontline experts and the ones that are ultimately kind of putting you on the prescription.
He also recommends calling your insurance company, ask if there are more affordable options, then look to other resources.
These are things like manufacturer patient assistance programs, foundations and nonprofits. You can also look at cash options such as like GoodRx or the Mark Cuban Cost Plus Drug Company. These are all resources that can make your drugs cheaper.
And if you hit a dead end, the Prescription Drug Affordability Board says you can contact them directly. If they can't answer your question, then they will point you to someone who can. In Baltimore, Mallory Safaste, WMAR 2 News.